practitioner in the early 2000s, the roles weren't where I wanted them to be in nursing. So I think many of you might be surprised to hear that I did the nurse practitioner course at Dalhousie in cardiac, and then in geriatrics, and then I really didn't work much as a nurse practitioner because the roles were very physician-focused, and they weren't what I wanted to do as a nurse. So I actually moved into women's health and research because my master's thesis was in women's health, and all the cardiac work I did was about a women's health rehab program, so you can sort of see how it makes sense as you go along. That's my story in nursing. That's my story of knowing nursing and being a nurse, and what made it possible. And this is really key. This is where a lot of the people that I polled today to find out, what should I tell them? What did you want to hear when you were in the audience? They said, well, I want people to know that they have to start now taking advantage of opportunities. Being open to change. Most of you are of a generation where people tout you as the change agents, that you're used to change, that you roll with change. There's lots of people that don't roll with change, and if you're going to be a nurse, you're going to be in settings where you're going to be very acutely aware of that. And yet, you're the generation that everyone thinks is open. So what does it mean being open to change? It doesn't necessarily mean that you have to be happy all the time with it, but that maybe you're open to what it could look like. Being engaged from the beginning, that is always helpful. So if you know a prof that you really enjoy, and you know that maybe they're engaged in some other activities, or even you just want to say to them, how come you like this so much? Or what did you do to get good at this? So let's say they're a really good professor. Let's say they're really passionate or enthusiastic. Ask them why. When you're in the clinical setting, I always say to my students when they graduate, and it's a little bit of a cheerleader talk, I'm like, be that nurse that you want to be. Like, the nurse that you're in the unit and you're like, oh my God, I want to be that one person. I want to be he or she when I grow up. I want to be that. And, I don't think anyone ever wants to be the really nasty person that's miserable and cranky and hates everybody. And just, I'd never go back to school. If you're going back to school again to be a nurse, that doesn't make any sense. I'd never do that. I don't know that many people sit and aspire to be that person. I really don't. So I would encourage you to think about who does have a lot of passion for the profession? Who actually says the words, I am proud to be a nurse? That's somebody that I would align myself with. That's somebody I did align myself with. And I asked them, how do I become you? I had students come to my office before and say to me, how would I do what you do? And I was like, okay, sure, here, I'll show you everything I did. Not as a discouragement to say, well, it actually took me 5 years, because it doesn't have to. When I went to the ICU in Moncton City Hospital, no one was happy to see me. I was 21, 22 years old. I was about 10 years younger than everyone else there, at the minimum. And ICU in that hospital was a place you graduated to. You actually earned your way there. I put in so many hours on the floor, and then now I'm here. And it was just this whole different mindset. And so I was all sunny and happy, and I took ICU courses, and I was a new grad, and I had my degree. And for the most part, people were just annoyed by me. And I saw the world very differently. I believed in doing things different. And it was really evidence-based. And again, I wasn't really respectful of where they were coming from. But I did quietly. Like, it's funny, Janet said, you can win the people over. You can win them over. I remember one night I was there at my patient's bedside and working really hard to, titrate their inotropes and save their life and work with their RT for their ventilation. And one of the most senior nurses came over to me and she kind of whispered, do you think you could help me with something? And I almost fell to the floor. I thought, oh my God, this is my moment. I think I had to pee instantly. I thought, what could I possibly help her with? And she said to me, you inspired me to do the ICU course. I've been working in ICU for 15 years, and I had never done the ICU course. And she said, I'm doing the ICU course. And she said, you know how on day 3, the patients have a fluid shift? And, okay. I said yes. tell you right now. I said yes like this. Uh-huh. I did not really know that on day 3 there was this major solution. And I was like, thankfully she told me that, but she knew it, because on day 3, all of her abdominal aortic aneurysm repair patients would shift their fluid. So it would come from extracellular in, and they would have like overload. So you'd have to give them Lasix, and you'd watch their CVP rise, and so I was like, wow. She said, I only know that. I don't know that that is written about. Can you find a reference for me on that? Well, you guys know. You guys could find me a reference probably right now while I'm talking to you on your phones. I mean, I found her a reference. I found her 10 references. I helped her write that paper. And then we had this newfound respect for one another, and it was like that meeting ground. And so there is opportunity to win people over, but it does have to do with having respect for where both people are. Even if they're not where you're at, they're probably thinking the same thing about you. And I think that that's one of the biggest lessons, the hardest lessons, and one I still struggle with. Because people are still sometimes not always welcoming, or not always kind, or maybe not always in a good place. And it's maybe understanding that. Also volunteering, that was another thing I got to do. People ask me today, why are you volunteering with YWCA? I'm like, well, you know, I've been doing women's health for 10 years now, and it seems like the best organization to do it for, and not everybody has time for it, but if you say to me, Sherry, what makes you most passionate? How come you are so optimistic and enthusiastic about nursing? I would tell you it's because I do all these things. I would tell you it's because I juggle teaching, research, community health. I'm still a community health nurse. And volunteering. I would tell you it's because I feel that all of these things give me back energy. And I would focus on the now. I mean, you do have to think about the future, but that's the luxury sometimes of being youthful, is that you can think in the now and take action right away. Aligning myself with people who inspire me. That would be one of my biggest messages today. It fueled my passion, it motivated my actions, and it inspired my research. Which is where I'm going to go now. So I know what I know about nursing. But what do we really know about nursing? What does society know about nursing? What are the nursing stories out there? One of the big nursing stories is the last decade has been a shortage. It has real implications for what's happening in our world right now. It's happening for all of you. I mean, the students that I spoke to in my PhD work said that their parents told them all the time, you know, there's a nursing shortage. You can get a job. You can be a nurse anywhere. You can work in any location. You can change it around. You know, they're never going to be short of nurses. And that was a period of time when parents, their jobs had uncertain futures. People were losing their savings. And so there's a lot of focus on having security. And what we did was we recognized, you know, there's an aging nursing workforce. Well, guess what? That means there's also an aging population. And that means those people are sicker and they're living longer. That means that healthcare, we don't have the capacity to meet their needs, so we need more people too. So we built more seats. We brought in more nursing students. We brought in more of you. But can the system meet the needs? Then we realized, you know, you have to think of it all. You know, are there enough preceptors? Are you getting the orientation experience that you need? Are you getting the practical experience to make you feel confident? Are you getting the support? Are the preceptors burnt out because there's so many of you and so little of them, and they're aging and their patients are sicker? And people are leaving nursing. And the new graduates, even if they say that they're not going to leave, it's just as bad to say, well, no, even if they don't leave, it's just as bad to say you're going to. Think about it. The people who don't quit, but say they'd like to, that's not good for a workforce. That's not good for a workplace. And we also have students leaving to go elsewhere again because of the need for options, the need to pay their student debts. Why study career choice? Because I know from the literature, theoretically, and my own experience, that when you enter nursing, you have perceptions and expectations of what that's going to be like. And if there's a huge divide between what you signed up for and what actually happens, that's not going to be fun. You might want to leave. And my students would come back to me after I sent them out, told them to be the nurse that inspired them, would come back to me within 6 months and cry in my office at the IWK and say, you know, this isn't what I signed up for. And I was like, really, what do you mean? And it would terrify me. It would make me reflect upon how could I help better prepare them? What could I have told them if I could go back? What would I say to them? And I thought, you know, I really have to understand, what did they think? What did they come in with? So my PhD focused on who are the future nurses and how did they come to choose nursing as a career? Because I thought if I could understand what brought them here and what they're thinking and what knowledge they come with, maybe we can shape our educational system. Maybe we can help them make decisions early on that maybe might lead them to nursing, maybe might lead them away from nursing, might bring different people into nursing. I focused on the millennial generation, and I have to say I will never post a chart of, you know, you're in this generation and this is what you look like and this is how you act, because I think that we all don't want to be boxed in. And honestly, I'm of Generation X that preceded the millennials, and I have to say, I don't like the description of me. It sounds horrible on paper. So I wanted to reshape, actually, a little bit the understanding around the millennial generation, because I didn't think it was a fair depiction. I actually, in doing a lot of research and speaking to a lot of people, who in this room was born after 1980? Yeah, exactly. So you guys just validated everybody always challenges me on this in publications. They're like, you know, not all of our nursing students are of the millennial generation. Bam! You guys just showed that most of you are, and more of you will be. So this is valid, that's good. A year after I graduated. So I looked at this group and thought, you know, who are you? You're really informed. You're far more informed than I was. I was watching Pink Panther, and you guys are watching like a reality show about, you know, Médecins Sans Frontières. I mean, I couldn't believe how, and technologically savvy, you just can't argue that. I mean, that's your world. You can do things in minutes that would take me hours to think about how to plan to do it. So I wanted to know what your stories were. I'm not going to go into a lot of detail about my research findings, but I'm going to tell you about the two big messages that I took away. Is that what is so inspiring to me is that people still choose nursing to make a difference in people's lives. They do. They want to make a difference. They want to help people. They want to give back to their communities. They are thinking globally. And I was inspired by that. They also struggled because they were brilliant women. The women that I interviewed, they were all women in my study. Men were invited, but there were only women that responded to the call. And all of them were brilliant. They did really well in school. They had really high marks. And I could see them struggling a little bit with the fact that, you know, people don't often push you towards nursing or encourage you towards nursing if you do really well in school or you're really smart. And I could see them kind of struggling to make sense of it. Well, do I want to sign up for something that when I present it to people, they say, but you're smart enough to be something else. You could do something else. I mean, that's a struggle. I was actually proud of them for still choosing nursing when they still received negative comments. The bedpan comment, really? 20 years a nurse. All those roles, and I would never categorize what I did in the terms of bedpans. That's not to not acknowledge that providing direct care, caring for people, caring for every aspect of their needs, which does at times involve elimination and bedpans, but not the comments that you receive when you tell people you're a nurse. Sometimes I like to challenge people's perceptions of nursing by telling them all the things I do and then ending with, I'm a nurse, because their eyes are huge. Like, wow, what do you do that you can do all those things? And then you end with, I'm a nurse. And so I could see these students struggling with that they wanted to do this, but then the other hand, choosing a career isn't just about wanting to make a difference in people's lives. You have to make a living. So that's just as important. You know, you want to set yourself up to have a good life. You know how nursing is socially positioned in relation to most often medicine. And that's a hard one to grapple with. You know, how are you going to work as a team when you already know that you're set up in opposition with the main team member you're working with? So choosing a career is about aligning yourself and setting yourself up for a good life. And what does that mean when you're graduating and there's no jobs? Or there's not a job in the area that you're living, or maybe your family lives. So there's a lot of implications there for how we can do things better, how we can recruit people differently, how our messages, and I think messages are the biggest thing for me. Career choice is really complex. In no way did the students' narratives make that simpler for me. It is a real passion, a balance of passion and pragmatic, so making a difference, making a living, it's both things. Being compassionate and being a critical thinker. You know, I felt that they were struggling. They had a lack of opportunity to know the realities of nursing. They had a lack of access to nurses. I remember when I shut off the tape recorder, a few of the nurses just wanted to interview me and say, and actually they weren't nurses at the time, this was before they entered nursing school. They wanted to know, who are you? How do you're going to be a doctor, nurse? I mean, how does that happen? What does it mean? How did you get there? And I thought, you know, they were really wanting to find out all of that. And wouldn't it have been great if they had found out some of it before they signed up for their profession? And maybe we can do that better. And there's a really outdated imaging of nursing in society, and we have to attend to that. These are some of the images. Well, first off, these are the only ones that I could show here today because they're just obscene. If you type nursing images into Google, I mean, it's bad. But these make no sense to me. I have never approached anyone with a stud. She's beautiful, and that's really nice, but honestly, never happened. Also, the way this woman down here is holding the tray. I take great offense to this holding the tray stamp that we put out. No offense to CNA, but I don't get it. That's ergonomically just not good. Back problems. I'm being facetious now. These are some real images of nursing. I looked at all these images and thought, I've been there, I've done that, those are real. I mean, come on. Some of these people, I know this is an outdated cast, but some of these people work in different subspecialties. I've worked in Emerge, and that's never happened. Ever. Ever. And everybody laughs and says, you know what, Grey's Anatomy, we know that's not real, but look at this, guys. I'm going to tell you right now. How many people critically analyze if this is real? People watch this, and they're like, Grey's Anatomy isn't real because people aren't having affairs in the hallway. But we give away our nursing roles. This just doesn't happen either. Again, subspecialties, I think plastics, OBGYN, maybe neuro, all coming together around one middle-aged man. It just doesn't happen. It doesn't make sense. And we give away it's not that what we do as nurses isn't just mind-blowing. It is. But we give it away to other people. It's not 5 physicians who run out to meet an ambulance. It's 1 nurse. I've worked Emerge for years. My friends work in the emergency room now. It's the nurses and paramedics that are in the emergency room department. And they're emergency room physicians, but there's rarely ever 1 or 2, 1 in small hospitals, sometimes none. So I want you to pause and think about what messages this sends. If you knew that these were all nurses, a lot more people would sign up, maybe and think, that's exciting, I'd like to be a nurse. It's not that what we do isn't exciting or brilliant or smart, it's that it's given away to other people. We also have to be smarter and more innovative in how we provide learning opportunities. We can't have more mentors because we can't grow the people that are in the system. They're leaving us, they're retiring, they're burnt out. How can we do innovative things? We had an 80-20 mentor program where we actually had mid and late career nurses. We gave them 20% of their time to mentor incoming new graduates and work on new graduate initiatives. It was brilliant. Summer camps. Who here went to a summer camp? Anybody? Yeah, I sent my child to summer camps, engineering summer camps. There are no nursing summer camps. I want a nursing summer camp. I just think that would be fun, you know, like, and you make it age appropriate. You blow up the gloves and you do that sort of thing. But, you know, I think that could be a lot of fun. I think that we have to use social media. And I just got a grant, actually, to disseminate the findings, to share the findings of my research, and to do it using small videos, YouTube videos, Facebook groups, and I have hired one of my grad students to help me with it. And I mean, she's brilliant. Like, I'm learning from her and inspired by her ability to just navigate this world. Johnson & Johnson. I'd like you all to search Johnson & Johnson. They have a campaign for nursing's future. That's the video I was going to show. Last year in 2012, they launched a video series that showed 3 scenarios of nursing. One of them is a black nurse going to meet an ambulance. She rushes to the ambulance and says, "Who do we have?" The paramedics respond. She says, "On my count." She directs care. They bring the patient in. She says, "Tube, bag," calls for a portable chest x-ray. She's assessing for a vein, starting a large bore IV. She's she's demonstrating all that we do, assessing, analyzing, planning care. She's a nurse. She announces she's a nurse. And then they show her in the ICU, and she tucks the lucky charm into the patient's hand in ICU. And she says that she believes in science, and she also is a human, and she believes in luck. So there you go. We don't have to throw away the caring aspect of nursing, but we do have to foreground and claim the critical thinking and what it is that we do, and why it is that nursing is so relevant. We also have to tell our stories. This is something we've been criticized for years. You may not like this book. I didn't at times like this book. It's by Baruch and Gordon. Suzanne Gordon speaks a lot about nursing from a very critical perspective of how we often say that we care and we wear our hearts on our uniforms, and it really does us a disservice. I personally don't subscribe to the hearts on my uniform approach. I mean, I do tell people what I do. I introduce myself fully. My name is Sherry Price. I am your nurse. I'm your registered nurse. I'm going to take care of you today extends to, we're going to monitor your vital signs, this often, the patient, the family member. We're going to do these tests today. I'm going to coordinate those procedures. I'm going to monitor and evaluate your response to these. I'm going to plan your care in collaboration with. I give voice to what I'm doing. That sounds, I think, brilliant. It's certainly more comprehensive than I'm going to care for you. I mean, inherent in that is that I am going to approach people holistically and compassionately. I think that I want you to tell your stories about what you can uniquely provide. Why did you sign up for nursing, and what are you going to bring? Tell people. This is the really important point. I touched on it earlier. Listen to others, though. Other people have stories. The nurse who's nasty to you, there's a reason she's nasty. You don't own it, and it's not right. And yes, confront and challenge it. But be respectful back, because just like you feel they don't hear your voice, and you think that they're wrong, they're thinking that about you. And it is a fine balance, and it's a lifelong lesson to learn. The second part of your theme is motivating action. It made me think of leadership. I love this leadership quote by Greta Cummings. She's the person I cite most in regards to nursing leadership. Leadership is seeing the present for what it is, and the future for what it could be, and you close that gap so that you can enable, so that you can achieve the preferred future, what you want it to be. You guys can do that. You guys can do that in spades and in your sleep, because I think you have a vision that extends beyond what we currently provide. That's the great thing about new minds and new insight. So what do we know about leadership stories? I went and surveyed some people, and I got their stories to share with you. And I sat down yesterday with a friend of mine. These are not the real names, but these are names of people who I love dearly, and most of them I think are nurses. Kate came to my house yesterday. This isn't her quote, but I said, which of these should I cut? And she said none, so I will talk fast. And I hope they're not translating to French, because it's going to be nasty. Kate says, I vividly remember being a 17-year-old nursing student, watching one of my teachers review the cardiovascular system. She was so dynamic and filled with energy, and I remember thinking to myself, I'm going to do that someday. I'm going to teach student nurses and help them along their way. Several years later, during a critical care course, again, this nurse, Kate, was mesmerized by her teacher, and remember thinking, I want to do that. These women made such an impression on me because of their knowledge, skills, and attitudes. They made me proud to be a nurse. Best compliment you will ever get, ladies and gentlemen, men and women, for my opinion, is to be told that you made someone proud to be a nurse. Kate teaches critical care here in Halifax. Sarah, in the first 2 years of my nursing education, I had the opportunity to be involved in nursing research as a student on a project with her supervisor. And that supervisor just took the time to mentor her and show excellence in nursing practice. And prior to this, we would have lost Sarah to medicine, because that was her plan. She was taking nursing to possibly go into medicine. It was her undergrad. And she said that the hands-on experience of doing research validated her decision to enter the profession, and she went on, Sarah is in a master's program. Kelly, she was admiring Mary, who worked in neurosciences but went into CCU. And she decided to change her specialties, and she read her orientation manual, listened to heart sounds, became very competent. These are all true stories. This Mary went on to, when they opened a cardiac surgery program in St. John, New Brunswick, she went on to be the one who recognized the need for a cardiac rehab program and started it up. Matt, he talked about the fact that he saw a new grad being bullied. And he didn't just say, well, stick up for yourself. He actually put himself out there to be bullied a bit by this nurse and actually confronted her in a respectful way, but made her really aware of her actions. And then gave a wink to the new nurse and said, you know, we're in this together. And I think that's an important message, is to know that other people experience it. This story almost always makes me cry, because a child died once in an ICU, and it was a new nurse, new to PICU. And she was going to quit. I mean, it can be that devastating in that moment, because she blamed herself. And this Cindy is one of my dearest friends, and she works in the ICU. She worked there for years. She's not in that role anymore. And she rallied the whole team around that person so that she didn't feel alone, and they actually shared their own stories where they felt that they were responsible for something. And maybe a child had died and they blamed themselves. Sarah talks about the fact that she had never seen anyone really do a head-to-toe assessment. And then one time, her very first buddy nurse, she remembered, her name was Kathy, and she remembered the patient's name. This is so true that you remember this stuff. Ethan. And they did a head-to-toe assessment, and she was like jumping for joy. She's like, oh my God, you really do this stuff. And it inspired her to do her head-to-toe assessments and to use that, like again, be the person that inspires you, to be the best you can be. Anne talks about the fact that, you know what, sometimes what makes a difference is being kind to one another. This unit manager encouraged them to ask new people to go to break with them, to actually find out about them sincerely. You know, to be interested and engaged. It is about relationships. And that makes the difference. It's like in junior high and high school. You know how you don't want to miss a day? You're like, I'm not sick. Meanwhile, you have like a fever and your mom's like, you have to stay home and you don't want to. It's like, wouldn't you love it if you loved work so much that you didn't want to miss a day because you'd miss your friends, your colleagues? And I think this is the last one, and I think that this is about taking the time to recognize that something isn't right. Visitation policies. This Stella, she went and was doing her baccalaureate degree. She was a nurse for several years, I think 12, and went back to get her bachelor's as a post-RN. And her project she did in school was visitation policy. The nurses in the ICU weren't so impressed, but she worked with them, the manager, and in the end it was accepted. And she felt like a leader because she was able to do this. Leadership is about relationships. It is about seeing the future, guys, and getting us there. You guys can do this better than anybody. I really believe that you have the vision. I believe that you won't just hope, but you'll have the vision to get us there. I believe that you won't wait a single moment to do it. I think that just in this moment, just as accessible as knowledge is to you and technology is you're able to use it, I think that you're the best suited to actually help us make a difference and to change the world. And don't ever doubt for a second that what you're doing makes a difference. Because you know what? It's always been that way. That it's a small group of people, it's the things that sometimes seem so simple that make the biggest changes of all. This is a timeless story. I brought this book with me. Several of us, my friends, have received this as a master's present or when you graduate with your master's or your PhD. And I've read this to my son a lot. I'm not going to read it to you today, but I would encourage you to go back and read it, because it does have some messages about, you know what? Sometimes it's hard, but you'll get through, you will succeed. And these are my final thoughts that I do, and I borrowed this a little loosely, but I actually researched it, and Mahatma Gandhi did not actually say, be the change you wish to see in the world, something around that. But I do believe you should be the changes you wish to see. If you want people to be nicer than you, you show them how you be nicer to new graduates when they come in and you're out there, and you're the mentors. Believe in yourself, we believe in you, absolutely. And if you doubt yourself, know that we all doubt ourselves. I doubted myself last night when I was preparing this for you here today. And you know what? I don't regret saying to students when they leave, find the nurse that inspires you and be that person. You know, I'm inspired by nurses every day. And I have to end my presentation by thanking the 12 amazing nurses who participated in my study. These are not their names, these are pseudonyms, but I honored them by giving them the names of people that I love. And that's the end. Thank you.